Don't want to talk too much about commissions right now. It can get us off track. So let's talk a little bit about Part D. So we've covered our supplements. Now we're going to cover Part D. Part D is your prescription drug benefits. Your prescription drug benefits follow the annual election period of October the 15th through December 7th for enrollment. There's also disenrollment, which is our Medicare Advantage disenrollment period from January 1st to Valentine's Day for all you guys out there. Just in case you don't know what date that is, that's February the 14th. So at any point in time, they can make a change to their Part D. That's the only time they can enroll in a Part D unless they have a special election period. Now, they do have the initial election period that is from their age, excuse me, of turning 65, or if they're under 65, within 3 months of them getting their Part B on their Medicare, red, white, and blue Medicare card. So you make sure that you follow those enrollment periods. Also, as we know, they don't have to enroll in this, but I do want to touch on the late enrollment penalty. There are many people that have decided not to get a Part D, okay, or they may have group coverage that has Part D coverage or better. So let me explain to you how this penalty works if you don't already know. If you have a Medicare beneficiary that has not enrolled in a Part D prescription drug plan and they don't have equal or better coverage to a Part D prescription drug plan from a group, an employer-sponsored plan, retirement package, or some other kind of Part D or some other prescription coverage, they are going to be subject to a penalty. That penalty is 1% of the national average of the year that they're enrolling for the lifetime that they have not had a Part D prescription plan since qualified or had other coverage. That 1% is not a one-time fee. It is added to the cost of the Part D prescription coverage, whether it's a standalone or within a Medicare Advantage plan, for the life that they have that policy. So if we looked at last year's, it was 31 cents a month. So if you had somebody that hadn't had their prescription drug plan for 5 years, then you would take 31 cents every month, and you would multiply that times 60 months, and then you would know that they'd have an $18.60 a month penalty every month that they have a Part D for the rest of their life. So it's really important that they have some sort of prescription drug coverage in the form of a Part D. Now, you also have to understand that our MAPD plans include the prescription drug coverage, so there's no penalty there. They could have a retirement plan that has prescription drug coverage, no penalty there either. They could also have a group-sponsored plan, no penalty there either, as long as they've had other coverage. That penalty is collected by Florida Blue or their particular carrier that they're working with and provided to CMS. And those penalties are also going to be defined for high-income individuals, because high-income individuals can also get a penalty for being high-income. So, pretty crazy. All right. So, VA benefits, it would have to have qualified coverage with the prescriptions, which they normally don't have. VA benefits, unless they're full VA benefits, good question, Clark, is not going to count unless, of course, it has the full-on TRICARE. So standard VA is not going to qualify typically because they can go to the VA, but they don't really have that Part D coverage. Okay, so let's talk about the donut hole. All right, so everybody gets really confused about the donut hole. I really think it's quite simple. Usually after we explain it to everybody and everybody kind of wraps their head around it, it works easily. So this is how it works. So in the beginning of the policy, they call that the initial coverage period. This donut hole is going to really start, okay? And this is how it works. I get my policy, I go to CVS, I go to Walgreens, I pay my copays. That's the initial coverage period. When my cost plus the cost that the insurance company is paying, so in other words, the full cost of the drugs, okay, reach $2,850. This is going to be 2014. So this is going to be 2014, everybody. So let me just change this so that way nobody's confused. There we go. So what's going to happen is the full cost of the drug is what's getting me to the donut hole. Once the full cost of my drugs reaches $2,850, now I am in the donut hole. Now, so you understand, the donut hole is closing and closing and closing. So last year, the initial coverage period was a little less. It was $2,550 last year, and now it's $2,850. So what they're doing is they're closing that donut hole. Now, once I get into the donut hole or the coverage gap, at that point, I am going to be responsible for 72% of the cost of my generics. But in essence, how you explain it to your client is you're going to be responsible for more money when you're in the coverage gap. At that point in time, your cost plus the cost that the manufacturer and anything else that is being paid is going to get you to catastrophic coverage. Once you get to catastrophic coverage at $4,550, now you're out of the donut hole and you're in catastrophic coverage. So how does this go in layman's terms? Mrs. Jones, let me explain the donut hole to you. You're going to have an initial coverage period, or when you first start filling your drugs, the whole cost of the drugs is what counts to get you to the gap. Now, when you're in that initial coverage, you're going to have your copays, so you're not going to have to worry about anything except for your copays. But once the total cost of the drugs reaches $2,850, you're going to get into the donut hole. When you're in the donut hole, you're going to pay a higher amount for those drugs, 47% of the brands. You're going to pay 72% of your generics. And then after you get to $4,550 worth of true out-of-pocket costs, at that point you're in catastrophic coverage, and everything will be very, very, very inexpensive. Those people who qualify for a low-income subsidy, here's something to perk your ears up to. If you qualify for a low-income subsidy, then at that point you are going to go straight to the catastrophic side of coverage, and you will avoid initial and the coverage gap. Okay? This donut hole applies to all of our policies and everything that's dealing with Medicare. However, Florida Blue has policies, as you guys should know, that is going to give coverage within the gap. Our local PPO, our option 2 on our prescription drug PDP plan, our HMOs are going to have coverage in the gap, and that coverage in the gap is a very powerful selling feature, especially for our clients that have a lot of medications. So in that initial coverage period, as you can see the example here, if the drug costs $100, but you have a copay of $20, the $100 is what's clicking you away to get to that donut hole or to that gap. So the gap is shrinking, and it's going to get smaller with healthcare reform and all of the different good stuff that's going on. So you want to make sure that you're comfortable with that. There's a couple of documents that I put into the Dropbox that you can reference when it comes to the donut hole and when it comes to understanding Part D prescription drug plans. So someone's asking about 97% of brand name drug goes towards the, no. The $4,550 is a true out-of-pocket, so it's going to take the total of the $2,850 plus your other out-of-pocket on top of that $2,850 to get that true out-of-pocket, or that troop, they call it, okay? So when you go through that coverage gap, the only thing that's really counting towards what's getting you into that catastrophic coverage is what you're paying. The donut hole does not include Part D prescription drug plans, prescription drug coverage, because as you know, Part B does cover some cancer drugs, cancer medications, and that has nothing to do with our Part D. These are for outpatient drugs only. When you're dealing with hospitalization or in-hospital drugs, and drugs that are administered under the Part B of the coverage, usually the way that you can define what's a Part B drug, those Part B drugs typically have to be administered by a healthcare professional. Chemotherapy, chemotherapy, typically dialysis and those kind of things, those are going to be covered under your Part B. They're not going to be covered under this Part D. Separate, this is for Walgreens, CVS, those kind of things. Okay. Does Florida Blue send people info on how close they are coming to the donut hole? Yeah, they do. So what happens is that you get an explanation of benefits. We can also define when clients will hit the donut hole with some of the tools that we have available. Okay, so now let's talk a little bit about prescription drug plans. So with the prescription drug plans, they are standalone plans. We have two different options, as you guys know. I'm not going to go into the details of the options today. That's more product. It's just today's kind of the rules and really what you need to understand. Now, with the prescription drug plans, we have the two, option one, option two. If someone buys a Medicare supplement, then you would sell them the standalone prescription drug plans. And one of the big things that we're going to go through is how we search for those drugs and how we are conscious about searching for those drugs as well. There is those filings for high-income earners that we talked about that also applies to Part D. So there is a late enrollment penalty on Part D, and there is also the high-income individuals who are going to get a penalty as well. So that's two pieces that you need to understand that are very important. One thing I didn't touch on, which I apologize, I need to get back to, is going to be late enrollment in Part B. I know I did talk about, that if someone has not enrolled in Part D, that they can do so after the fact. But let me just go back to that because I did want to spend a minute or two on late enrollment in Part B, like boy. Okay? So what happens if you don't exercise your enrollment in Part B? You can only enroll in Part B at certain points in time of the year unless you have a special election reason. That special election reason is only if you had other coverage that was in the style of group coverage or a retirement package. So if you did not exercise your enrollment in Medicare Part B and you did not have other qualifying coverage, then you are only going to have an effective date eligible for July for Part B. So what happens is that, let's just say, for argument's sake, you get someone on the phone in the annual election period. It's December. It's the last week. And what will happen is in that last week, somebody's going to call you and say, hey, I really want to enroll in one of these zero premium plans. You say, fantastic, let me come out to your house. You go out to their house, you meet with them, you sit down, they pull out the red, white, and blue Medicare card, and all you see is an effective date for Medicare Part A. Well, you can't help them because they don't have Part B. You go through the steps of calling CMS and finding out, and they tell you very nicely, no, Mr. Jones does not have Medicare Part B. So now that Mr. Jones is going to have to apply for Medicare Part B, and his effective date, unless he has a special election reason, is going to be July. So you will not be able to help him with Medicare Part A or B. He will have to wait until July. So here's a good question to see if anybody has been paying attention. What could you do for that guy? Could you sell him and offer him and give him any form of protection? He's got Medicare Part A, but he doesn't have Medicare Part B. What could you? Matt, you are incorrect. You cannot sell a supplement, and you're not alone. You cannot sell a supplement because you need Part A and Part B. You cannot sell them a healthcare reform plan because they qualify for Part A. You could give them a temporary coverage if they were under the age of 65, but if they were over 65, you could not sell him a temporary plan. The answer is a drug plan. The only thing that you could sell that client is a drug plan, simply because he has Medicare Part A, so he doesn't qualify for health care reform. You have to have A and B in order to qualify for a supplement, and a temporary coverage is not going to be working because with that temporary coverage, you typically have to be under the age of 65. You do have, because he has Part A, ACA is out. Okay, he does not qualify. So thank you for the few brave people that answered that, and I don't know why everybody else didn't try and chime in, but thank you. So yeah, you have to understand that what you would do is you got to wait till July. Once July rolls around, then you could absolutely help that client and get them set up. The answer is part D. Very good, everybody. Okay, does anybody have any questions about what we've covered so far with these late enrollment in part B? All right, so I'm going to go back to our prescription drug coverage now, and then what we're going to do is we're going to talk a little bit about our formulary list. The formulary list is always the same in how it reads. I'm going to pull one of them up so we can look at them. The formulary for 2014 has already been released. It is up there for your viewing pleasure. And the way that it works is when you look at this, there are a couple of key factors that I want everybody to understand because I've heard it delivered the wrong way several times. And I want to make sure that we're delivering the information accordingly. So there's some 3 different things that are very important that you understand. Stepped rate therapy, quantity limits, prior authorization. Now, a stepped rate therapy is something that the insurance carrier utilizes to control costs. It saves the carrier money and saves the client money. And what that means is that if your client has a course of care that they may recommend trying a few lower or less expensive drugs before they get to the more expensive drugs, and that's called stepped rate therapy. Now, if your doctor or if the Medicare beneficiary's physician has already done those steps, then that physician just needs to write a letter to Florida Blue and they could avoid the stepped rate therapy if they've already done it with a different carrier or under a different insurance policy. So they don't have to go through that process again. The physician just writes a letter. Quantity limits. The FDA recommends the certain use of limits of certain drugs that over prescribing certain medications could cause harm or depending on what it's being treated for. So there are quantity limits with many medications. You'll see a little note in the column. It'll have a little checkbox if it's a quantity limit. And if that quantity limit needs to be surpassed, then the doctor again would have to write a letter. And the doctors are already accustomed to doing these things and making sure that they are getting what you see as the next step is prior authorization, meaning that the doctor is going to have to write a note while you need that medication. Very basic 101 stuff. There is a transitional fill that we do with Florida Blue, meaning that if your client is migrating from, say, United Healthcare to Florida Blue or a different carrier, and that particular Medicare beneficiary is taking a drug that is not on our formulary list, they can get a transitional fill, get it at the correct tier that it needs to be at in order to transition into a different medication. Under the rules of CMS guidelines, Florida Blue has to offer therapy drugs that will meet all requirements underneath their guidelines. And it means that if, for example, United Healthcare is using a drug on their formulary list to treat heartburn, for example, we also have to have a drug that treats heartburn. It just may be a different drug. It just may have a different name. One of the big things was there was a drug that was really popular last year, which was a combination drug of metformin and I can't remember what it was, but it was a combo drug. It was a compound medication. Well, some of our competition had that on their formulary. They had that on their formulary as a tier 2 generic, Well, what we did is we had them both as tier 1s, but they were 2 separate drugs. So our clients would just have to take 2 pills instead of taking 1 pill, but it dropped them down in a tier, and that was a lower expense for the client. So just take some time, go through the formulary list with your clients, and make sure you understand these basic terms because these basic terms are really important, and people get very excited when we talk about their drugs. Now, the transitional fill, the quantity limits, the step rates, the prior authorization, that falls in line with all of our plans that have Part D coverage built into it. And as you know, all of our Medicare Advantage plans do have prescription drugs built into them, and you can't avoid it. So you can't have a separate Part D with a different carrier and have our health plan. There are carriers out there that have MA plans with no Part D, but not Florida Blue. Okay, Anyone have any questions regarding the formulary list, step trade authorization, all of that good stuff?